Hello everybody, my name is Yang Jingguan from IBM Institute for Business Value. This screencast provides a brief overview of our latest study, The Future of Connected Health Devices, Liberating the Information Seeker. For this study, we conducted an online survey of more than 1,300 users of home health electronics in US and UK. Technological advances are enabling smart new connected personal healthcare systems. First, devices are becoming instrumented with the ability to measure, sense, and see the exact health condition. Instrumented devices automatically capture information. Sensors are embedded to recognize physical changes. Second, devices are becoming interconnected. A variety of wireless technologies remove the information barriers so that the data can be integrated with other data, solving one of the inefficiencies in sharing information. Devices monitor vital signs and activities in real time and communicate with other devices and caregivers. Lastly, health devices are becoming intelligent. Devices have enhanced computing power, and combined with advanced analytics, they can turn the health data into intelligence, providing insights and recommendations. Analytics programs monitor device data and use rules and logic to compare against targets. We have identified 4 different components in the ecosystem around patient and their use of devices. 2 components of devices that consumers use, and 2 supporting components that enable the ecosystem. These have already appeared and are evolving, and using these components together could lead to highly effective patient monitoring and ultimately better health outcomes. Mobile devices include mobile phones with health-related applications, as well as mobile health devices. They provide monitoring, data collection, and sharing of data regardless of location. Home-based devices provide solutions that monitor conditions in home settings, outside of clinics. For both device categories, interoperability with other devices will increase the value of health devices. Web resources provide related content such as condition description, nutrition information, and statistics. With interactive and user-friendly interface, web resources play a crucial role in easy and efficient data sharing. Health records are fundamentally necessary component for the ecosystem. Health records in digital format makes the collecting, storing, and sharing of the data possible. Then who are the target consumers? We segmented the consumers into 3 different groups by their health needs and focus: motivated healthy, chronically monitored, and information seekers. Motivated healthy are people who are highly attuned to health, wellness, and exercise and keeping very close tabs on their health. On the other end of this spectrum, there are a group of people who need to be chronically monitored. They do have long-lasting or recurrent health conditions such as diabetes, cancer, epilepsy that require constant care and formal monitoring through medical devices or by healthcare professionals. And there are information seekers, the people in the middle, the largest population. They are mostly healthy and do not have life-threatening conditions. However, they could have better controlled their conditions if they had the right information and were monitored correctly. And these are the group of people to target. Information seeker is not a homogeneous group. Examples of such consumer groups include people with sleep apnea, smokers, people with obesity, pregnant women, hypertension, and children with attention deficit and hyperactivity disorder. Information seekers are a huge market, and we believe they are now underserved. Then what are the consumers' needs? Our consumer survey revealed that ease of use was a clear priority, with 96% of the respondents ranking it as most important criteria, and price is the second with 76%. 79 of them expect to incur some out-of-pocket expenses not to exceed $100. This will require manufacturers to come up with affordable devices, implementing incentives such as decreased insurance premiums to capture more consumers. The top data requirement is privacy and security, as noted by 77% of the respondents. This confirms that the privacy and security of personal health data is a minimum requirement for health devices. Most consumers want devices that provide them with immediate feedback and can facilitate more meaningful conversation with their health professionals. Devices should not just measure and show data, but also provide an interpretation of what it means and what they need to do. In terms of importance recommendation, product recommendations by healthcare professionals such as doctors, nurses, and pharmacists matter the most. So it is important for companies to get medical community support. To serve the information seekers, device providers need to define their role in a broader ecosystem, which include a variety of industry players in healthcare, life science, technology, and telecom. And as no single company can provide the connected devices and associated services alone, they should consider the power of open standards and increase the role of partnership. Here are our specific recommendations. First, focus on total solution design. Focus on ease of use of device solution to reach targeted information seekers. Identify your position in the connected health device ecosystem. Evaluate your core capabilities and the benefit of intellectual property investment versus partnering. Develop solutions to provide data timely and in user-friendly way. Convergence of mobile communication and interface advances will lead to breakthrough in diagnosis, treatment, and monitoring. Use the power of social network to help individuals to stay healthy. Examine emerging digital media and social networking business models and allow users to share relevant data with supporting networks. Get involved with building the ecosystem infrastructure. Promote industry-wide effort to develop standards and improve interoperability of devices and ease of use, as consumers and clinician adoption are tightly linked to these attributes. And finally, learn to collaborate with new partners, and to do so, develop partnering skills to collaborate effectively within the connected device ecosystem. For a complete study, please go to this link on our ibm.com. And for any further questions, please feel free to reach out through authors listed here. Thank you for listening.